Good day and assalamu alaikum warahmatullahi ta'ala wabarakatuhu. So in this video, we will discuss the two systems, gastrointestinal system or your GIT and also your musculoskeletal system. So this will be the last part, okay, nakasama sa coverage ng ating midterm exam. So the midterm exam will be focusing on the assessing your cardiovascular system, your respiratory system, your gastrointestinal system, and your musculoskeletal system. So let's discuss first your gastrointestinal system. So from the word gastro and intestinal. So this is the assessing of your stomach, okay, and also the intestine. So starting from the mouth down to the esophagus, down to the stomach, to the small intestine, the large intestine, down to the rectum or anus. So ano to, review lang regarding sa ating gastrointestinal system. We all know that our GI tract is responsible for the digestion of food, taking in nutrients, and absorbing water. No? So, the digestion starts in the mouth, which is what we call the mechanical digestion. So, with the use of your tongue, your teeth, okay, your salivary glands. So, these are the accessory glands that helps you digest food, no? Break down food. So, dito nagsa-start yung ating carbohydrates breakdown. Until papunta siya sa ating mahabang kanal, which is your esophagus, papunta sa ating stomach, in which doon na magsa-start ang ating chemical digestion. Bakit tinatawag na chemical digestion? Because there are certain juices or acids na kailangan ma-release ng ating stomach in order para mas ma-digest pa yung ating mga foods na kinakain natin, and at the same time makain ng ating mga cells and then maging basic na mga glucose, no, which is yun ang pagkain ng ating mga cells. Then pupunta sa ating small intestine. Okay, so we have different parts of the small intestine, starting with your jejunum, ileum, and then jejunum, duodenum, and your ileum, no? So dito naman nangyayari yung absorption ng nutrients. Then papunta na naman sa ating large intestines. We have your cecum, your descending colon, transverse colon, and ascending colon, no? So, and then papunta sa ating rectum. So, dito naman nangyayari sa large intestine yung water absorption, okay? And also the formation of your stool, no? Or your tae, okay? So, let's discuss paano ba yung mga kailangan nating i-assess with your GI system. Now, the first thing that we do is to gather subjective data. Now, ito pong sinasabi ko dito is hindi po to separate na per system. Ang gagawin po natin, remember po, sa ating head-to-toe assessment, we will start on the health history. Now, yung health history nyo po is para mas maganda din yung pagkaka-organize niya, you may start by system. Then as follows, pag sa assessment na or sa physical head-to-toe assessment, doon na naman yung by system, no? So, sa mga sa subjective data, ito yung mga kukunin natin. So, the health history, as such, your presence of dental prosthesis or comfort of usage. So, dito tatanungin natin kung gumagamit ba sila ng any, example lang, postizo, naka-veneer sila, or dentures, yan. So, pwede tanungin natin sila kung okay ba, hindi ba nakaka-alter sa kanilang taste, sa kanilang pagkain, yung paggamit ng dental prosthesis. So, the difficulty of eating or digesting food, yung mga patient na may dyspepsia or laging kinakabag, no, may indigestion. If the patient, we will ask also if the patient had undergone a, weight loss, lalo na kung may changes over the past 3 months, past 2 months, no? So, another is to assess the pain. So, pain may be caused by distension or sudden contraction of any part of the GIT. So, you have to assess for your rebound tenderness. Ito pong rebound tenderness na to, ito yung pag pinapalpate ninyo yung specific part of the abdomen, and then pag bumalik siya, kaya nga rebound, pag bumalik siya, I feel that the part is tender, and then pag bumalik siya tapos naka-feel siya ng pain, that may be cause or a sign of appendicitis. Usually po, di ba yung ating appendix is nasa right, no? So, usually po, if ever po magkasakit po or masaktan po yung patient natin while ginagawa natin yun, so, ang tendency nun is baka meron siyang tinatawag na rebound, tenderness, or appendicitis. Now, for the iliopsoas sign, so dito pinaposition natin yung patient natin in a supine position. And then, raise natin yung leg nila. So, the psoas sign or iliopsoas sign is also known as your Cope signs. Ito yung Cope. Cope na C-O-P-E. Cope signs or Cope psoas test, or what we called also the Sova sign. So dito, it is a medical sign that indicates irritation to the iliopsoas group of the hip flexure in the abdomen, and consequently indicates that the inflamed appendix is retrocacial in orientation. So dito, pag ipaparaise mo yan sa patient mo, yung kanyang leg, may mararamdaman siyang pain, no? Sa kanyang what do you call this? Sa kanyang iliopsoas group na flexure, mga hip flexure siya, mga muscles dyan, no? Pag naman sabihin nating obturator sign, okay, dito naman is pinaposition natin yung patient in a supine position, and then naka-flex po ang kanyang paa. So this is a clinical sign of acute appendicitis, which is defined as discomfort felt by the subject or the patient on the slow internal movement of the joint while the right knee is flexed. So it also indicates that there is an inflamed pelvic appendix that is contact within the obturator internus muscle. Okay, so yan po yung dalawa na mga signs or tatlong signs na pwede nyo yung i-assess na that definitely magsasabi sa'yo na ang patient mo has appendicitis or the inflammation of your appendix. Now, ito po yung mga common sites of referred abdominal pain. Now, yung pain po natin, ang dami pong klase ng pain natin. We have the acute pain, chronic pain, radiating pain. Pag radiating pain is nagsastart sa masakit, papunta sa ibang parte ng ating katawan. That's radiation kasi lumalapit or pumupunta siya sa ibang parte ng katawan. Pag naman po referred pain, hindi yun yung specific na area kung saan nandoon yung organ, but doon natin nafe-feel yung ating pain. So we have here dito sa right shoulder, pag masakit daw yan, may problem ka sa liver. Dito naman sa baba ng nipple, sa right, we have the biliary colic. Okay, so pag naman dito sa mas babaan niya, dito sa may parang may pagka sa side ng puson, we have your cholecystitis, pancreatitis, and duodenal ulcer. Yan po, makita nyo sa right, sa pinakababa, we have the appendicitis. And then dito naman sa malapit sa ating ari, okay, sa taas niya, we have your colon pain. And then sa singit, we have your ureteral colic. And then sa taas naman, we have renal colic. And then dito naman sa taas ng ating left breast, no? Andiyan dyan naman, if maramdaman mo ng pain, baka may sakit ka sa puso. Okay. So, yan po yung mga iba't ibang signs ng sites ng referred abdominal pain. Now, meron po tayong tinatawag na PQRST pain assessment. Now, this is a pain assessment po na ito po yung pinaka-general po na pag-assess natin ng pain. Na pag yung patient po is nagreklamo ng pain, ito po yung mga iba't ibang itatanong natin. So, this is an mnemonics po, which is P stands for your provoke. Okay, ano po yung nagpo-provoke or what causes the pain, no? Pag sabihin po natin provoke, letter P stands for your provoke. Okay, what causes the pain? What activities na nag-aggravate ng kanyang pain? Okay, now let's go for the Q. Pag sabihin po natin Q is for quality. Okay. Ano po yung characteristic ng ating pain na nararamdaman? What does it feel like? May cramping ba? A severe cramping? A stabbing? Okay? Burning or a crushing pain sensation. So, yan po yung itatanong natin sa kanila. Now, for the R is for your region. Okay? Region or the radiation. No? Saan nagra-radiate and saan parte exactly masakit yung nararamdaman mo. So, di ba, we have, if you can still remember your anatomy and physiology, we have 9 regions of your abdomen. Okay? So, sa pinakataas, we have your epigastric. hypogastric, and then sa left and right side niya, we have the left and right hypochondriac. Sa baba ng ating dito sa ating umbilical region, okay, dito sa side niya, we have the iliac, okay, the left and right iliac, and then sa lumbar. By the way, lumbar po yun siya. And then sa pinakababa, we have your um, hypogastric pala. Sorry, sa taas, epigastric. Sa baba, hypogastric. Then, sa side niya is left and right, iliac. Okay, so ulitin ko. Okay, so ito po yung abdomen. So, ito yung abdomen. So, we have the right 9 regions. Dito po makikita ninyo. Okay. So, i-divide natin. So, dito po, we have your epigastric. And then, dito, right and left hypochondriac. And then, ito po naman po is yung umbilical. And then, dito po is right and left lumbar. Then, dito naman po is your epigastric. Hypogastric, and then dito naman po is left and right iliac region. Okay. So, yan po yung mga regions na kailangan familiar tayo para alam natin kung ano yung specific na area kung saan na-feel ng ating patient yung pain. And then for S stands for your severity, which is dito itatanong natin is your mga pain score or pain scale. Now, tatanungin natin from 0 to 10. 0 po yung walang masakit, and then 10 yung pinakamasakit. How will you rate your pain, ma'am or sir? Okay? And then last is your T, which is the time or the duration. Kung kailan nag-start naramdaman ng patient yung pain, and hanggang until what time, or hanggang until how many days, no? Yung duration niya. Okay, the next is another na subjective data is specific data if the symptoms that are present. So example, situation or events that affect your symptoms, the onset or possible location, duration, and character of symptoms na naramdaman ng ating patient. A relationship of specific foods, smoking, or alcohol to severity of the symptoms. Now, meron po tayong tinatawag na dalawang klase na ulcer, type of ulcer. We have gastric ulcer and peptic ulcer. Peptic ulcer, no? Iba po yung dalawa kasi. When it comes to relationship of food, pag po yung ating gastric, pag hindi po nakakakain yung patient, hindi siya nakaka-feel ng pain. Nakaka-feel po siya ng pain if yung patient po natin is kumain. Now, pag sa peptic ulcer naman po, ang ating patient nakaka-feel ng pain pag hindi po siya nakakain. And pag nakakain po siya, nawawala po yung kanyang pain. Okay, so baliktad. Pag gastric po, pag kumakain yung patient, nakakaramdam ng pain. Kasi ang affected area dito is the stomach. So, once syempre may ulcer na syempre pag may digestion, may food, magre-release yan ng gastric juices yung ating stomach. So, pag mag-release yan siya, mas mag-i-increase yung inflammation niya, mas sasakit yung ulcerations niya. While as yung ating peptic ulcer, doon sa kanila, mas maganda na kumakain or nakakakain yung ating patient. Kasi mas hindi nila na-feel yung or na-alleviate yung kanilang pain pag nakakakain sila. Unlike ng ating gastric ulcer. So, another is to ask the patient for his or her normal pattern of bowel elimination. So, what is the frequency? Ilang beses ba siyang tumae sa isang araw? The character of the stool. So, syempre, tatanungin mo talaga ano yung itsura. Pag sabihin, okay. Kasi dapat tinitingnan kasi ng ating patient. And also, if the patient uses laxative or yung tae, no? Kasi lalo na if ever yung patient nyo is constipated or sanay na gumamit ng mga laxative kasi syempre nagpapapayat sila or enemas. Yan po yung enemas, yan na po yung tube na pinapapasok po sa rectum para po pinapalabas yung dumi, no? Especially yung patient natin if has a chronic constipation, isa po yan sa mga management niya. Okay, so another is the recent change in the normal pattern, such as if ever merong changes in the character of the stool, okay, if ever meron siyang constipation, diarrhea, or alternating constipation or diarrhea, or changes in the color of stool. So, we have here the two medical terms. Melena means meron pong presence ng black tarry stool. So, black tarry stool po ang ating melena. And if it is present in your patient, it means that your patient is having upper gastrointestinal bleeding. While as your hematochezia, it is a presence of fresh blood in the stool. So meaning po may lower GI bleeding po ang ating patient. Or you have to take note if the patient is taking drugs or medications that can alter your stool, such as taking iron, no? Kasi yung iron supplement po, nakakaitim po yan siya ng tae. The same po yung mga tuberculosis medication. I think it is, I forgot, rifampicin ba? Basta, you research on it, nandun po yon, ano yung nakakaitim ng tae. And we have also measures taken to relieve symptoms if the patient is taking any medications to relieve any symptoms na ma-feel niya pag nagkaka-constipate siya, agad-agad umiinom siya ng anong bang medication or tea, ano ba man siya, no? So, we have here the Bristol stool chart. Okay, so I want you to really study on this kasi it will be included in your exam. So, dito, pinapakita po yung characteristic ng stool. Okay, pag ano yung type 1, ano to, the ano to, characteristic, and then the meaning. Okay, kung pag ganito po na separate hard lumps, very constipated po yung ating patient. Okay, the normal is yung type 3 and type 4, in which yan po a sausage-like with cracks in the surface and a like smooth, soft sausage or snake. Yan po yung mga normal. Pag mga lacking fiber, we have the type 5. Okay, type 6 and type 7, yan po yung mostly nakikita natin sa mga especially, actually type 7, yun po yung pinaka-normal na nakikita po natin sa mga patient na nagda-diarrhea kasi may inflammation or nagpa-fight ng infection ang kanilang GI tract. So again, yan po, I hope ma-memorize ninyo yung ating Bristol stool chart. Now, so, let's go on the objective data. So, ito na po yung head-to-toe assessment natin. So, ano po yung mga i-assess natin? So, the first one is assess for the presence or absence of tenderness, organ enlargement, masses, and spasm or rigidity of the abdominal muscles, fluid or air in the abdominal cavity. So, ito po yung mga anatomic location of specific organs na kailangan i-assess ninyo. Sa right upper quadrant, we have the liver, the gallbladder, duodenum, right kidney, and hepatic flexure of your colon. For the right lower quadrant, we have your cecum, your appendix, your right ovary, and your right fallopian tube. For the left upper quadrant, we have your stomach, your spleen, your left kidney, the pancreas, and the splenic flexure of your colon. And for your left lower quadrant, we have your sigmoid colon, the left ovary, and your left fallopian tube. So, ito po yung sinasabi kong 9 regions. So, ito po, if by quadrant, okay, 4 na quadrant. At ito naman po, pag mas more specific ka is your per region. Okay. So, what are the assessment technique? Diba? If you can still remember, sinabi ko, pag ito po yung abdomen, sa lahat po ng assessment, we follow the general system, inspection, palpation, percussion, and auscultation. However, dito po sa ating gastrointestinal tract or sa ating abdomen, we use APEPA. We start with the inspection and then auscultation, percussion, and then palpation. So let's start first with your inspection. So we assess the skin for the color, the texture, the scars, the striae. Pag sabihin po nating striae, yan po ay stretch marks, no? Engorged veins, visible peristalsis, such as pag meron po yan, baka meron pong intestinal obstruction yung ating patient. Visible pulsation, if baka may abdominal aorta ang ating patient, and visible masses if baka may hernia or outpouching na nangyayari sa GI tract ng ating patient. Assess also for the contour if it is flat, protuberant, or globular. And then assess for umbilicus if it is in midline. Kasi normally po, nasa midline po ang ating pusod. Okay, pusod. Sorry. And then we have abdominal distension measure. So, if the patient has abdominal distension, pag sabihin po natin abdominal distension, parang matigas yung feeling ng kanyang tiyan, and then the patient feels bloated. So, you have to measure abdominal girth, no? To check if there is changes, or waistline or the circumference at the level of the umbilicus, or 2 to 5 centimeter below your umbilicus. Okay? And then after is you auscultate. Now, auscultate for the bowel sound. Okay. So, yung bowel sound natin po, marinig po yan, parang nag-gurgling sound po yung ating stomach. Okay? So you auscultate in a clockwise fashion. Again po, clockwise. So you will start on the right. Okay? So in each quadrant. So note presence or absence of peristalsis or your vowel sound. So pag nag-auscultate po tayo, within every 5 to 20 seconds, may narinig ko po kayo o narinig po kayong at least 1 to 2 sounds, and then that is normal. Now, pag after 20 seconds nakarinig po kayo ng pang tatlo, pang apat, that's normal active po, no? The next is pag hypoactive naman. Pag hypoactive, meron po sa loob ng 2 minutes, dalawa or isa lang po yung narinig niyang vowel sound. Pag absent na po, wala na po siyang narinig. 3 to 5 minutes. Pero ang pinakasigurado po natin, within 5 minutes, pag wala po talaga kayong marinig na sound, that is absent vowel sound. So, baka meron pong peritonitis or inflammation of the peritoneal cavity ng ating patient or paralytic ileus. So, paralyzed na po yung kanyang iliac region, no? So, we have, the ileum, no? Sa ating small intestine. So, we have hyperactive naman sa loob ng less than 30 seconds, nakarinig kayo ng 5 to 6 sounds. So, yan po, hyperactive. So, ito po ay present pag yung patient natin is may diarrhea, may gastroenteritis, or inflammation of the gastric lining and the intestinal tract, and then your early intestinal obstruction. So, also auscultate the abdomen for vascular sound. So, you use your bell, no? The bell's part of your stethoscope. Okay? So, ito po yung pag-assess ng vascular sound. Okay, so yan po yung part kung saan tayo po makakarinig ng mga vascular sound, or you have to look for any sound or brewy sound na actually research niyo lang sa YouTube ano yung brewy sound, and then pakinggan niyo yung sound niya para ma-familiarize kayo, kasi hindi ko siya as in magawa, no? Or hindi nyo properly marinig or ma-appreciate kung ako yung gagawa ng sound. Okay, so ayan po yung mga specific area kung saan po tayo makikinig ng mga vascular sounds. Kasi pag sabihin natin vascular sound, pakikinggan po natin yung mga blood vessels or arteries that is present, kasi sila po yung tagabigay po ng mga blood, ano? So usually may mga marinig po tayo dyang normal na mga example dito sa artery, makakarinig ka talaga dyan ng mga pulses na kailangan talaga walang any murmurs or any brewy or abnormal sounds. Okay? So, after the auscultation, we have your percussion. Now, and lastly is your palpation. Okay. So, sa percussion po, we use either direct or indirect percussion. So, it is done to confirm the size of the various organs and to determine the presence of excessive amounts of air or fluid. So, the normal po na maririnig po natin during percussion is tympani. Tympani po sa ating stomach area. Pag dullness naman po or flatness naman po, pag sa area of liver and spleen and solid structure. Warning po, do not percuss if the patient has abdominal aortic aneurysm. Okay, kasi if ever po ipopercuss nyo po, baka may possible na pumutok po siya during your percussion. Another also, during your percussion and palpation, the area kung saan, example, meron na pong sign of pain ng ating patient, may nireklamo na po siyang pain sa inyo. Na-assess nyo na po kung saan parte ng region ng kanyang abdomen masakit. So, wag nyo pong ipapercuss ng first. Pahulihin nyo po yung percussion or pag-assess doon sa in pain na area para po hindi all throughout in uncomfortable position po yung ating patient. Syempre kasi pag yun ang inuna mong in-assess, baka mag-radiate na yung pain all throughout the abdomen region. So, hindi mo na ma-identify kung totoo bang painful ba or hindi yung area na ina-assess ninyo. Okay, so after your percussion, we have your palpation. So, either we use your light and deep palpation. So, this is to determine the size of a liver, your spleen, your uterus, your kidneys, or if it is enlarged or not. And also, it is used to determine presence and characteristics of abdominal masses, and to also to determine the degree of tenderness and muscle rigidity if present po. It's either the rebound or direct po yan siya. Okay. So, for the assessment of the rectum, so sa rectum po, chine-check po natin dyan is the perineal skin and the perianal skin. So we assess for the presence of pruritus, or pag pruritus po, yan po pangangati. Okay, if the patient reported na laging makati yung part ng kanyang rectum or anus, i-check natin baka may mga maliliit na yan dyan na mga microorganisms or mga worms. No? We have fissures, we have your external hemorrhoids or rectal prolapse. Pag sabihin po natin rectal prolapse, yung kanyang rectum lumabas na po, no? Lumabas na kanyang rectum. Okay. So, makikita nyo po dito sa picture. So, it includes the inspection and palpation of your anus or peri. So, you position your patient in the left lateral position or Sims position. For prostate exam naman po sa mga lalaki naman po ito, you ask your client to bend over forward with hips flexed and the upper body resting on the table and bed. And then drape the patient to avoid unnecessary exposure of your genitalia. So again po, you use gloves po ha, hindi po bare hands sa paghawak po kasi mako-contaminate and then baka pwede po makakuha kayo ng sakit sa ating pasyente. Okay. So now, let's proceed on your assessing the musculoskeletal system. I hope naintindihan po yung assessing the gastrointestinal system. So if you have clarification, you can just scan your lecture guide kasi andun naman po yung mga diniscuss ko. And another thing, I will just provide you another book na nakita ko online na maganda po siyang reference din nyo po para gamitin niyo for your head-to-toe assessment. Para hindi nyo po laging nakakalimutan. Kung hindi nyo man maalala lagi yung lecture ko, meron naman din kayong libro na bibigay ko or e-copy na e-book na every now and then pwede nyong buklatin at i-check through your phone or your tablet para nababasa ninyo at nare-remind kayo. Kasi always remember that your health assessment is very important, especially if mag-duty na po kayo. Okay. Now, so for your assessing the musculoskeletal system. So this is a combination of two. So actually pinapagsabay na po natin kasi we all know naman that most of our muscles is attached with your skeletal system. And the function itself, yung dalawang system na to magkapareho for the posture, for the movement, okay? For the, sa muscles naman is to regulate, tumutulong din sila for the regulation of body temperature. Sa ating skeletal system is the deposits of your calcium. Okay, so yan po, no? So, ang function niya is nakakatulong po siya sa ating bones, sa ating katawan for the movement. Okay? Kakatulong din to for the contraction, especially sa muscles. We have your cardiac muscles na very important for the contraction of the heart. Okay. So, for the general data na i-assess po natin for the musculoskeletal system, we have to note the size and shape of the joints, the limbs, and body regions. We have to note the patient's stance, okay, yung posture niya, yung kanyang movement. If the patient has any difficulties in moving his limb. So, we let the patient walk back and forth in the room. Okay, check natin kung paano ba siya maglakad. If meron ba siyang pain na nararamdaman. Okay, we assess for the bones and joint movements through your range of motion. If you can still remember sa inyong anatomy and physiology na discuss yung joint motion. So, we have your retraction and protraction. We have your flexion, extension, circumduction, abduction, and adduction. We have your internal and external rotation, pronation, supination, eversion, and eversion. Okay, so I don't need to discuss it further pa kasi masyadong haba kasi ando doon na po yun siya sa inyong anatomy and physiology. So if you wish to scan, check nyo po yun, nasa skeletal muscle po siya na part. So diniscuss po doon yung ating mga iba't ibang joint range of motion. Okay, so for evaluating your temporomandibular, so head-to-toe assessment po tayo dito. We will start where you're dito sa ating temporomandibular. So dito part po sa inyong jaw. Okay, yung nag-open and close dyan. Yan po, ina-assess po natin yan. So, check po natin if the patient can, masticate properly, no? Can chew food properly. So, inspect for any presence of swelling, Okay, pamamaga, symmetry and trauma. Evaluate the ROM of the mandibular joint by asking the patient to open and close his mouth. And then also, after the temporomandibular, assess naman yung neck and neck ROM. So, inspect for tenderness, the nodules, swelling. So, check for the ROM in the neck. So, which is ipapaas mo yung patient. Gawin tong mga procedure na to such as yung ear, ipapalapit sa shoulder, chin to the chest, chin to ceiling rotation. Okay, and then assess after the neck, i-assess na naman yung spinal position and curvature and the range of motion. So note for any tenderness, swelling, spasm of the spine through palpation. You ask the patient to bend forward at the waist and then measure the length of the spine. Note, no? So, and then note for your abnormal deviation of the spine, such as your scoliosis, kumbaga, S curvature of your spine. So, lateral deviation of the spine. The kyphosis is the thoracic curve that is abnormally rounded. So, if you can still remember po yung ating assessing the respiratory system or your thorax and lungs, ando dun po yung mga curvature, abnormal curvature of the spine or the chest area. And then we have your lordosis. The lumbar spine is abnormally concave. Yan po yung position ng ating mga buntis, mga pregnant woman. Yan po, mga lordotic posture. Okay? And then for the assess the shoulder and elbow, so note for asymmetry, muscle atrophy or deformity. Note for crepitus or tenderness. Assess shoulder muscle for firmness and symmetry. Palpate the elbow and the ulna for subcutaneous nodules and assess the shoulder ROM. So ipapagawa mo to sa ating patient, such as ipapa-abduct, okay, away from the midline, adduct papunta sa midline, and then adduction is away from the midline and abduction papunta sa midline, forward motion, backward extension, flexion, extension, external and internal rotation, and your supination and pronation. Okay. For the wrist and hands and fingers, so note for any tenderness, nodules or bogginess. Assess for the ROM of the wrist and fingers, such as by doing the radial and ulnar deviation, extension and flexion of the wrist, extension and flexion of the fingers, abduction and adduction of the fingers, and also assess for your carpal tunnel syndrome. There are two signs na i-assess natin po sa ating patient na pwede natin po masabi that the patient is experiencing carpal tunnel syndrome. Ang ating carpal tunnel syndrome po, yan po ay problem po sa pressure po sa ating, usually sa median nerve po sa ating wrist and finger. So, may compression po or may build up na pressure po dyan in which yung nerve po dyan is hindi na nagnanumb or sumasakit na po yan siya. So, normally po, ang nakaka-experience po nito is yung mga addict po sa pagkukomputer, okay, na which po yung kanilang positioning ng kanilang kamay po by using the computer or laptops is hindi po naka-position ng maganda and wala pong rest period, no? So, yan po, yung mga pro gamer po, pwede po dyan, at least po yan siya in developing carpal tunnel syndrome. So, yun na po itong Tinel syndrome. Yung Tinel syndrome po is during the percussion of your carpal ligament, pag pinapercuss po natin siya, yung patient po natin is makakaramdam ng numbness or tingling shooting into the palm or finger. So, nakakaramdam po siya ng pamamanhid and parang nakokurente po yung kanyang palms and fingers. Pag fallen sign naman po, we place the patient or pinapa-bend natin, okay? Pina-flex natin, example, ipapalagay natin yung patient, papalagay natin yung kamay ng ating patient sa isang table and then ipapa-flex natin yung kanyang wrist and then ipapa-hold natin for at least 30 seconds, okay? And then or we put the back of the hands together, okay? So, yung likod ng ating left and right hands, put together natin yan siya for 30 to 60 seconds. And then, pag may maka-feel siyang pain or numbness sa kanyang kamay or fingers, positive fallen sign po yan siya. Okay, so these two signs signifies that if it is present on your patient, the patient is experiencing carpal tunnel syndrome. Now, for the hips and knees, assess for the hip R or M. So, as such, ipapa-flex mo yan siya. Ipapa-extension mo, which is ipapa-supine or ipapa-prone mo yung patient. Internal and external rotation, abduction and adduction. For the knee, ROM, flexion, pinapastand na, in a standing position, pinapa-flex natin and pinapa-extend natin. And we have to assess for bulge sign. So, we place the patient in a supine position and then we palpate the knee. Okay, bulge sign indicates excess fluid in the joint. Okay, so next is for assess the ankles and feet. So expect for swelling, redness, nodules, and other deformities. Note also for calluses, bunions, corns, ingrown tails, toenails, plantar warts, ulcers, hair loss, or unusual pigmentations. You assess also for ROM, such as hyperextension and plantar flexion and eversion and inversion. And also assess for your shoulder, arm, wrist, and hand strength. You ask the patient to extend arms with palms up for 30 seconds and assess for bicep strength, strength, and quadriceps strength, and your ankle strength. Okay, now for the grading of the muscle strength pa, pag ipapagawa nyo po yung mga ROM na yon, i-grade nyo po yung muscle strength niya. So, 5/5, which is the normal, so the patient can move joints freely. So, magagawa niya lahat ng ROM without any pain and against the gravity and against resistance. Okay? Pag 4/5, it is good. The patient completes ROM against gravity and moderate resistance. Pag naman 3/5, fair po, the patient completes ROM against gravity only. So, pag may resistance na, hindi niya na move or magalaw yung specific joint. Pag 2/5 naman po, poor na yan siya. So, the patient completes full ROM with gravity eliminated. So, meaning po, ito is na-flex and kanya if tinutulungan natin po siya. 1/5, trace po yan siya. So, the patient attempts at muscle contraction. So, pinapasabi natin na, ma'am, pwede niyo pong i-move, pero may contraction, but hindi niya na-move ng maayos. No? Ito, but po yan siya. Letter B. And then 0/5, no evidence of muscle contraction. Okay. So, I will give you some, common musculoskeletal abnormalities din na pwede po nating i-assess sa ating patient. Okay. So, we have here foot drop. Pag sabihin po nating foot drop, this is the plantar flexion of the foot with toes bent towards the instep. Pag sabihin naman, foot drop, parang, nahulog yung kanyang paa. Yung position niya is parang, nahulog ba, no? And then muscle spasm, a painful contraction of the muscles. And then muscle atrophy, which result from prolonged muscle disuse. Dito po is nag-atrophied na, or meaning yung muscle tone po ng ating muscles is wala na. So parang paghawakan mo na siya, para siyang marshmallow, sa sobrang lambot niya na at wala ng contraction na mararamdaman. Kasi nasanay na yung katawan niya na hindi na niya yun ginagawa or ginagamit. Okay? So crepitus po is the abnormal crunching or grating of the joint. Okay, muscle weakness, which results from a malfunction in the nervous system. A traumatic injury, which can be caused by fractures, dislocations, amputations, crush injuries, or lacerations. And then pain, which is anywhere from hands to the shoulder and then legs. Also, I will share also to you the 6 P's of musculoskeletal injury. Musculoskeletal injury. So, if the patient has injury, ito po yung mga symptoms, no, na pwede niya pong ma-feel. So, we have the 6 P's. Kaya nga 6 P's, 6 po na P's, no? So, it starts with your P, pain. So, assess if the patient can feel pain. Then, another P is your paresthesia, okay? Or numbness, or loss of sensation or numbness of the affected area. And then next P is paralysis, meaning po hindi na po maigalaw. The patient cannot move the specific injured part. Paralyzed na po. Another P is your pallor. Okay. Namutla na po kasi may paleness, kasi may or discoloration because hindi na po maganda yung blood supply sa affected area. And then pulseless, so wala na pong pulso yung specific doon kasi nga po poor, no? So you have to check po yung mga distal na pulses. Example lang, ano to, affected area is ankles. You have to check your dorsalis pedis and your um, tibialis na pulse sites. Okay? And then lastly is your P, which is your poikilothermia. Pag sabihin po natin poikilothermia, yan po yung coldness. Okay? Nanlamig na po yung parte ng part na yun na injured. A cool sensation of the affected limb. So, kasi po yung poor na po yung kanyang blood circulation, kaya po lumamig na yung parte or injured part. Okay? So, I think that's all for our assessing the musculoskeletal system. So, I hope na take note ninyo yung 6 P's ng musculoskeletal injury, the pain, paresthesia, paralysis, pallor, pulseless, and your poikilothermia. So, that is your 6 P's, mga symptoms ng musculoskeletal injury or a traumatic injury. So I hope you have all understood what I have discussed. So please do study the midterm coverage, which includes your assessing your respiratory system or the thorax and the lungs, assessing your cardiovascular system, assessing the gastrointestinal system, and assessing your musculoskeletal system. Okay? So thank you for watching my video and have a nice day.